Are you thinking about trying Auvelity for depression? Here are 6 essential things you have to know to make an informed decision. My name is Mattias Hartmann. I'm a board-certified psychiatric physician assistant working full-time in psychiatry, and I make educational videos on mood disorders. Let's start with the most critical thing first. Who can't take Auvelity? Well, if you have a history of seizures, bulimia, or anorexia, which are eating disorders. Of course, if you have an allergy to Auvelity, if you're taking an MAOI, a monoamine oxidase inhibitor, which is an older form of antidepressant that it cannot mix with other antidepressants, or if you have severe kidney or liver problems. Next, let's go over exactly how Auvelity works. Auvelity is a combination of 2 medicines, dextromethorphan, which is used as cough syrup, and bupropion, which is an antidepressant medication. First, let's go over dextromethorphan and how it works. Well, it blocks NMDA receptors. Well, what does that do? Well, these NMDA receptors live on GABA interneurons. These GABA neurons in the brain are relaxing and inhibitory. And when you block that, it blocks the GABA, and you get a surge of glutamate, which is an excitatory neurotransmitter, and that's what causes a cascade of events to happen that leads to neuroplasticity, meaning neurons will grow in the brain. The brain neurons will grow, and that's what you want. In depression, they shrink and go down, and when you treat with something like dextromethorphan, block NMDA, the neurons will grow again. It's very similar to how ketamine works. It also boosts sigma-1 receptors, which has been known to help with anxiety, and it blocks serotonin reuptake, which is similar to what other antidepressants do, like Zoloft and Lexapro and Prozac. Okay, well, what does bupropion do then in this mixture? Well, bupropion blocks norepinephrine. It's a norepinephrine reuptake inhibitor. It also weakly blocks dopamine reuptake, and it blocks something called the nicotinic acetylcholine receptor. And that's one of the mechanisms, along with dopamine reuptake blocking, that seems to be why it's helpful for people to stop smoking. But that's not all. What does bupropion do to dextromethorphan? Well, bupropion inhibits, meaning it blocks, a certain enzyme called CYP2D6, CYP2D6. We can just call it 2D6. And what does that mean? Well, dextromethorphan is metabolized by 2D6, meaning metabolized means it gets broken down. So if you block it getting broken down, then there's going to be higher levels of dextromethorphan in the body. And that's part of what makes this combination work so well. Next, let's go over the efficacy and dosing for Auvelity. How well does Auvelity actually work? What are the FDA approvals? And how do you dose this? How do you start this? Well, let's go over the FDA approvals first. What is it FDA approved for? Well, major depressive disorder. One and only, one and done. Next, what's the dosing for Auvelity? Well, the tablets are 45 milligrams of dextromethorphan, and that's mixed together with 105 milligrams of bupropion. What do? You start with 1 tablet in the morning, you increase to 1 tablet twice daily after 3 days, and that's actually the max dose too. And next we're going to go over 3 very specific studies, and some of these were actually used to get the FDA approval for major depressive disorder. So we're going to take a deep dive and look at exactly how well Auvelity works for depression. The first study we're going to start with is a 2022 study by Tabuti and colleagues. This was called the Ascend trial, and this was one of the trials that was used to get the FDA approval. What was it? Well, it was a 6-week study. It was a phase 2 trials. There are different phases needed for FDA approvals. It was a randomized controlled trials of 80 people, so kind of a smaller study. They were 18 years old to 65 years old with moderate to severe depression. Auvelity was given twice daily versus they compared it with just bupropion. So remember, Auvelity is dextromethorphan with bupropion, so they compared this new Auvelity medication to an active control, that's what that is, bupropion, twice daily. So people didn't know what they were getting, and half of them got Auvelity. What were the results? Well, remission, meaning the symptoms went away almost completely, was 46% with Auvelity, which is very good for studies, versus 16% with bupropion. And that means there was a number needed to treat of 4. Well, what does that mean? Well, if you treat 4 people with Auvelity versus treating 4 people with bupropion, then we would expect the next person, number 5, to get the desired result that we want, remission. Next is response. They also looked for that. And what does response mean? Well, it means the medication decreased depression symptoms by at least 50%. And in how many people did that happen? Well, 60% with Auvelity at 60.5 and 40.5% with bupropion. So both of those worked really well for response. And the number needed to treat for response was 5. Remember, a lower number needed to treat is always better. So 4 is better than 5. And most FDA approvals for medications, the number needed to treat is usually less than 10. Next, what are some important things we noted in this study? Well, there was no weight gain or sexual dysfunction. We'll talk more about the sexual dysfunction later. And it started working quick. It started working in about 1 week, whereas most antidepressants don't start working for 2 to 4 weeks. But the study did exclude, meaning it didn't have them in there, treatment-resistant depression patients. And treatment-resistant depression is defined as failing 2 antidepressant trials prior. And those people are a bit harder to treat. This study didn't look at that. And the next study here was a 2022 study by Losifscu and colleagues called the Gemini trial. Again, this was also being used for the FDA approval. It was a phase 3 trial, meaning they were one step further and closer to getting the FDA approval. Again, 6 weeks, this time a bigger randomized controlled trial. That's what RCT means, randomized controlled trial. There were now 327 people. Again, the same age range, 18 to 36, moderate to severe depression. And this time, they actually switched it up. They used Auvelity twice daily, and they compared it to placebo, meaning people were getting a water pill, something that doesn't work. Whereas in the last study, they were comparing Auvelity to an active control, bupropion, something that does work. And what did we find? Well, remission, meaning the symptoms went away almost completely, happened in 39.5% of people taking Auvelity and 17.3% in placebo. The number needed to treat for that was 5. What did we get for response? Meaning the symptoms went down by at least 50%. Well, 54% for Auvelity and 34% for placebo. Not bad for placebo. That's really good. And the number needed to treat for that was also 5. What are some important things in this study? No weight gain or sexual dysfunction. Again, we'll talk about sexual dysfunction later a bit more. It started working in about 2 weeks. Took a bit more time to start working in this study versus the previous study. And again, they did not include treatment-resistant patients, meaning no people that had failed 2 prior medication trials for depression. Next, let's look at a long-term trial, the 2021 COMMENT trial is what it was called. It was a phase 3 trial, which meaning it was part of the FDA approval. Open label, which means people knew what they were getting. They knew they were getting Auvelity, but they looked at this long-term. 876 people, both male and female, 18 to 65 years old. Again, moderate to severe depression. They were taking Auvelity, 1 tablet twice daily for up to 12 months. And what did we find? Well, remission, meaning the symptoms went away almost completely, at 1 week was 8%. At 2 weeks was 20%. At 4 weeks, now we're starting to get up there, 35%. And at 8 weeks, so if you give this 2 months to work, 60% of people will achieve remission, and that's very, very high. And at a year, it's even higher. So that's good. That means it works long-term, at least up to a year. That's what we know. Next, they looked at response. At a week, it was 19%. At 2 weeks, 40%. 4 weeks, 60%. Pretty good. And at 8 weeks, 80%. What did we get at a year? They were still at 80%. So we know it continues to work really well for at least up to a year. And what did they see with long-term use? No weight gain or sexual dysfunction. And here's a 2022 study called the EVOLVE trial. It looked at things a little bit different, and we'll go over that. So it was an open label, meaning everyone knew what they were getting. They were getting Auvelity. 186 people, male and female, 18 to 65 years old, moderate to severe depression. And they needed to have been treated with at least 1 prior antidepressant, so 1 antidepressant beforehand, not 2, not treatment-resistant depression, so just 1. And what were they given? Well, Auvelity, 1 tab twice daily versus placebo for 15 months. And what did they care about in this study? They wanted to know about anxiety improvement. How nervous, how anxious were you with these depression episodes? So they were looking specifically at anxiety. And what did they find? Well, remission, meaning the symptoms went away almost completely, the anxiety symptoms, at 1 week happened in 20% of people, and at week 6 happened in 60% of people. And at 12 months, so a year, 80% of people had anxiety completely better. Next, response. So anxiety decreased by at least 50%. At 1 week, it happened in 20% of people. At week 6, it happened in 60% of people. And after a year, response happened in 80% of people. Really good. Again, looking up to 15 months, no weight gain or sexual dysfunction. But here's what we really care about. How fast does it take to start working? We've gotten some mixed results here. And what do we need to monitor? Do we need to do blood work? What do we need to do? Well, let's take a look at it here. How fast does it work? Anywhere from 1 to 6 weeks. The one there is key. Most antidepressants take at least 2 to 4 weeks. So Auvelity works quicker. And what needs to be monitored? What do we need to check while we're on this medication? We don't need to check blood work. We do need to check blood pressure. It can sometimes increase blood pressure slightly. It works on norepinephrine, so that makes sense. Well, how should you stop Auvelity? Can you just stop it whenever you want? Yeah, pretty much. Just always discuss with your medical provider first before stopping any medicines, but that's how this one is usually stopped. It's usually not tapered off, it's just discontinued. Next, let's go over common side effects. And I'll tell you, Auvelity has some pretty good side effect profile, meaning it does not cause side effects very often. See for yourself here. Common side effects, starting from the most common to the least common. Dizziness, nausea, headache, diarrhea, sleepiness, sexual dysfunction, 6%. And this is interesting because we looked at the studies earlier and they didn't find any sexual dysfunction in all those studies we looked at. And that's correct. But after it got FDA approved, they continue to follow medicines to make sure they're safe. And that's called post-marketing. So in the post-marketing, they did find sexual dysfunction, 6%. That's very low. And we'll compare that to Prozac later. Dry mouth, sweating, decreased appetite, constipation, and anxiety. Next, let's go over some rare but serious side effects. Seizures, mania, meaning it could potentially precipitate a manic episode. It wouldn't cause you to be manic, but if you already have genes that predispose you to bipolar disorder, it could switch you into a manic episode. Suicidal thoughts. This is only in young people, so less than 25 years old. And this is the same for any psychiatric medicine. It doesn't matter what psychiatric medicine you start, every single one of them has this warning on them. And serotonin syndrome could also happen as well, which is where there's too much serotonin in the body, in the brain, and it can potentially be very dangerous. Of course, bupropion does not affect serotonin at all, but dextromethorphan does, and that's why there's this risk. Okay, well, what's the bottom line here? Well, let's go over some special considerations. Absolutely no weight gain. Little to no sexual dysfunction? Well, the initial studies didn't show any, and then the post-marketing, after it was FDA approved, did show about 6% of sexual dysfunction with Auvelity. Compare that to Prozac. Prozac's at 54 to 58%. So we can say little to no sexual dysfunction with Auvelity. So thumbs up there. Of course, it works very fast. It works faster than many other psychiatric medicines. It works in about 1 week sometimes, whereas others work usually no faster than 2 weeks. But here's the kicker. It's expensive. $1,144 for a month's supply of Auvelity. Why? Because it's brand name only. So unless your insurance is covering this, you're going to have a hard time getting it. No one can spend $1,000 a month. Is there another medication or health topic you'd like me to cover? Drop a comment down below and let me know. If you enjoyed this video, you might also like this video next on aripiprazole, the 6 most important things you need to know to make an informed decision when using that medication, which is an FDA-approved treatment as an augmentation strategy for major depressive disorder. I'll see you over there.